Good afternoon. Let us start so as to be on time. My name is Dimitris Boumpas. I'm president of the KESY, the Central Council Health. It is an advisor to the state, advising on good medical practice and medical training. I have the honor to moderate this panel that bears the title had before. And in order not to cause any delay, let me say that Mr. Moschelos, in his yesterday's presentation, has demonstrated the rampant changes taking place in the health environment. And amongst those changes affected, the introduction of innovation may appear as an additional expenditure in a very limited fiscal space. The participants and speakers in this panel consider that this is very superficial. We should not view innovation this way, and in innovation we do not include only drugs and devices, but also in the syllabus of physicians and the development of human resources and the optimal procedures in offering health services. We would like, therefore, to make this term of innovation more generic. And the question arising from all that viewpoint is whether professionals in the health sector are ready for adapting and accepting this viewpoint and best exploiting this innovation. Are we ready? And if not, how can we best prepare? And especially something demonstrated through all those days, how are we to have better coordination of all the involved agencies? The aspiration of all stakeholders is access to innovation to regard all citizens in an economically sustainable way, aiming at promoting the public health and not exclusively on individual diseases. To have a better health for all Greek citizens, that is. The main queries that we have raised to the speakers are the following. Which are the most important changes in the healthcare environment? This will be addressed by physicians and pharmacists. How do the various stakeholders in innovation view it from their viewpoint? How do patients and the industry view innovation? Are we ready for that? And other most important question is how will they assess it and how will they set priorities for that innovation? Which are the measures that we should take and on what priority? And most importantly, as I said, on which coordination? Let me start by giving the floor to Mr. Exadaktylos, who is really a disruptive president of Panhellenic Physician Association. We all admire his courage and readiness. And I would like to ask you, Mr. President, are we physicians ready to receive this innovation? And how can we prove that? And what do you think? How do you view things?
Good morning. I hope you can hear me well. Yes, fine. Thank you very much for your comments that not everyone hears pleasantly, and I will cut to the chase. Given that we're living in societies that have mature healthcare systems that constantly need improvement, but also in societies that have to cope with intense demographic problems, and they have requirements and they demand rather high quality healthcare for all citizens to be available. And given that health is costly, the most important investment for us is in human resources. That being said, I mean that we need to go back to insisting on the exceptional training and education of physicians, nurses and all those who come in contact one way or another with the patients. It's the only way to safeguard sufficiently, to protect and utilize the resources made available for health, which will be dwindling, I'm afraid, given that the needs will be on the rise. This may sound like an oxymoron, since we're living in a country with 68,000 doctors, but we're also living in a Europe and a Western world where, according to all indications and predictions, we will have fewer doctors and nurses than what we need in the near future, which is something that is already a reality for our countries. We're experiencing this in a field that is very crucial. And the second one, we have problems in anesthesiology and in general practitioners. Okay, because you too, Mr. Boumpas, know that pathology, if left without staffing in the future, this, in addition to everything, will have expenses skyrocket. Given that the various specialties dealing solitarily and without any classification with any patient will mean overconsumption of services and drugs, we believe that the most important thing is that whatever technology and science have to offer, in order for that to yield fruit and to offset what we want as a society, has to go through the exceptional training of our doctors. One might wonder, aren't they receiving good education? Well, I must say that we need to intensify this. And there is a question of numbers. We can't, with a very small population of patients, have a large number of doctors that can actually achieve to remain in high levels of scientific prowess, especially when we're talking about interventional medical acts. This is where we need to invest, and this, I believe, is the most important thing, because it requires a turn and a change of aspect in public debate. It is something that is very difficult, although it sounds very easy. Well, what we all want is a good doctor, but this is very difficult to achieve. We must, in our country, have a way to assess and evaluate doctors. There is none. There's a delay of decades. The Greek Doctors Association asks for it time and again, but we always find it difficult to explain what we mean. And what we do mean is that if I can diagnose something without any imaging method, it's best to do that rather than use up resources. If I can treat something with a simpler and most economical way, it's best to go for it rather than spend time and money elsewhere. Finally, I should like to say two things. First is, in order to deal with this problem of quality, we slide towards the actual structures that we need to staff, and we have an additional expenditure of resources in the wrong direction. One last thing that has to do primarily with the utilization of doctors of advanced age. This is something that we'll see as a side, but we need to discuss the terms and conditions under which these people will participate in the status quo of health after we reach a certain age, in terms of education, in terms of bringing fruition to things operationally, and so on and so forth. I think this is what I would like to say initially, and I suppose that we will have a second round later on. Thank you. Thank you very much. You were very simple, and from what you said, that education is good, but it needs to become more intensive and more strict. I couldn't agree more. All this innovation and emphasis in quality should not create additional bureaucracy and red tape that will remove time from the doctor that they could spend on the patients. Mr. President of the Pharmacists, are you ready for innovation? Where are you? What do you do? You were in the crosshairs. Let's leave that and discuss that a bit later. This is the main question. First of all, Professor, thank you very much for the honor of participating in this very interesting session. I will say but a few things, and I will refer to innovation and the relationship between doctors and physicians in order to have an interesting discussion, because innovation is inextricably linked to both the responsibility and the vision, because the problem lies within the vision. What will we do for the patient in the next 10 to 15 years? Wherein lies innovation. So I will try to put us in a mode of conversation that is very interesting. We're talking about the role of doctors and pharmacists in the Greek healthcare system, which is something that is both current now and in the future, because the healthcare system is not just a network of structures, it's a living organism that lives, explores, expands. It needs the collaboration of everyone. Pharmacists have a fundamental role in primary healthcare. First of all, imagine that we have the most dense network of pharmacies all over Europe. 11,000 pharmacies when Portugal has 3,000. Everywhere, and even the remotest island. This is tantamount to universal, immediate and fast access of citizens to pharmacies. The pandemic showed in action one thing, that pharmacists participated in a system in which they vaccinated a tremendous amount of people during the pandemic. In the first year of the pandemic, 3,500 vaccines were performed at pharmacies. The pharmacy was open and the patient had their pharmacy right next to their door. 1 million rapid tests. We helped allow patients unimpeded access to the drugs, because innovative drugs to come, they need to exist if they are to be made available to the patients. So at the moment we will need to cover the shortcomings. We were by the side of Greek citizens even when the health structures were shut down. Imagine that everything was down, the healthcare units were open, the pharmacies were open, and under an intense problem of pharmacy when they said that their colleagues were dying all over Europe, as well as doctors. So what do we do? Do we provide scientific advice? Do we inform and educate the patient? Do we participate in the management of chronic diseases for the prevention of complications? So at the end of the day, it is the most accessible area in the healthcare system, without appointments and without lists, waiting lists. For the citizen, it is a social capital that needs to be accepted with the utmost respect. And we have this. The pharmacy practice is a fundamental act of promoting and ensuring public health. We check the safety of each treatment, so we watch for interactions, we inform and we train. We contribute to the limitation of polypharmacy. Has anyone wondered how many patients, for those that the state pays very expensive, the tests, the hospitalizations and their in-house use, take their drugs and don't use it correctly, rendering them ineffective? And pharmacy services are not just for the privileged few. Here, in each neighborhood, on each island, in each mountain village, the role of the pharmacist is that of support and healthcare education. We're talking about education, innovation. The pharmacists were a constant partner of the AOP. It was on our backs that the system of e-prescription was built and flourished. The often checking for those prescriptions and the cross-border prescription may be executed in another European pharmacy and vice versa. With a rational use of pharmaceutical expenditure, we help the sustainability of the country's finance. But there are no reductions in the quality of services rendered, because the pharmacist is the person who ensures that the appropriate drug reaches the appropriate patient on a timely manner, with controlled cost and with the highest level of security. This is what we do with the high-expense drugs. The vision of the pharmacist today is a patient-centric, highly interconnected system where the doctors work with the pharmacists alongside each other. We aim at the simplification of prescriptions and the interoperability of the e-prescription system, and we are aspiring for communication with the doctors through e-prescription. So at the end of the day, when the doctor sees that a drug is not available, they shouldn't prescribe it and create problems to the patients. Do you know what a solution there is for the patient who goes from pharmacy to pharmacy and can't find their drug available? The doctor must be updated when a drug is there is not low availability or no availability. I'm not talking about the vaccinations of the adults have resolved tremendous problems, as well as the fact that here it is an open field of collaboration with all union associations of healthcare professionals. We will contribute to the management of hypertension, consultancy for quitting smoking and chronic diseases starting with Alzheimer's. The other day we were at a conference of presidents of all European pharmacists. What all pharmacists were thinking was, what is the collaboration with doctors? How can the pharmacy not of 2025 or 2030, the pharmacy of 2040 and 2045, what it will look like? This is how we work in Europe, and this is how we must do here. But that is not all. The design includes actions that have to do with diabetes mellitus and obesity. All of the above are based on the ongoing learning and education. Like Mr. Exadaktylos said, the key point is to educate healthcare professionals. Unless we have trained doctors and pharmacists, we cannot have innovation or even dream doctors and pharmacists and nurses who will offer the highest level of services, healthcare services, to Greek patients. So I can say that we have 10,000 pharmacies that are constantly trained. How we do this? Well, it's a matter of partnerships with high-level professors and pharmacists, in collaboration with the Anti-Hypertensive Society, with the Lung Society, the Cardiological Society, where we together, hand by hand, work to the same goal. So we are fixed on a modern interdisciplinary care for patients. Appropriate prescription, adherence to treatments, and collaboration between patients and doctors leads to better results, including the pharmacists. But herein lies a problem. We ask for the institution of the healthcare services by pharmacists to be paid, remunerated. We defend the rights of the citizen to procure their drugs with safety and with the scientific responsibility of the pharmacist. And the governor earlier talked about the high-cost drugs. I would like to say this. In no other European country is there an AOP pharmacy. There is the hospital pharmacy and the actual pharmacy. The hospital pharmacy with the clinical pharmacists have most of the high-cost drugs. The others, for patients that are ambulatory, are in the other regular pharmacies. We disagree with the fact that it's unthinkable for a drug to reach Castellorizo with the safety of a courier service as compared to the pharmacy of Castellorizo where the patient receives their drugs. And I will not quarrel with anyone, including the OP. The OP and the minister decided to avail 67,000 e-prescriptions to pharmacies, which means 2,800 prescriptions per day. The respective drugs that would go through the at-home channel. And mind you, it's very important because everyone here are into health one way or another. 600 prescriptions per day for the at-home service. All the rest of the 2,200 that is moved through the AOP system is drugs going to 67,000 distribution points that are not AOP pharmacies, and the patient can receive them. Yes, we did file an appeal against the Council of State because this is something that is unbecoming the scientific status of pharmacists. The Council of State will decide. Yes, both systems will have to work together because the doctors may want the AOP pharmacy or the neighborhood pharmacy that they will receive other drugs, or a courier service that I don't know in what conditions a drug will reach the island of Castellorzo, Simi, or a northern Greek village. Thank you very much for the time, and allow me to conclude by saying that what counts for me today is the role of pharmacists and the role of doctors, which is in tandem, complementary, and interlinked. It's different to have the role of a doctor who issues treatments and that of the pharmacist who dispenses drugs and offers consultancy. So together we can enhance prevention, enhance the outcome of treatments to make the healthcare system sustainable and effective. And it's a clear target. Why, Professor? Because we have at the center Greek patients to whom we have the obligation to offer the best services of health.
Thank you, Mr. President. I keep from your presentation that we have a very dense network of drugstores in Greece, almost 11,000 stores, and that was put in good use during the pandemic. But at the same time, the pharmacists are a very important link in innovative medicines, which are extremely complicated as well. Innovative drugs are more complex in their function, they are more expensive, and it would be good to have a parallel, another safety system that will educate the patient accordingly, and therefore your role is very important. So let us proceed with the other speakers, and we will resume. Good afternoon. Thank you. My name is Karelos Grigoris, the president of EFEX. How many of you know EFEX in this room? So it's association, the Greek Association of the Self-Care Industry. It is the broad use drugs, the self-care in Greece. Whatever the previous presidents have said, unless we had self-care, we would have had 100 million more prescriptions back in the health system, and we would be wasting 7 billion euros per year as a state. So a most important role is played by self-care, because this is the pillar, a foundation of the system, because we've got the biggest volume of incidents per day, who opt and select how they take their daily care for mild diseases. And more specifically, each day 1 million people use such kind of products of self-care. And this saves space, time, work hours, and from the physicians, health physicians, as well as the citizens. So who are we currently? Let us view the future, because we speak of innovation. As you said, 2030, 2040, we speak about the future. Of course, the world radically changes. And why do we need innovation? What is the environment? We live longer, we age. This is excellent. What is bad is that we have less births, and we are here, and therefore we have to take care of people for longer. And these people will be ever more demanding, will be demanding more things, and they already do in all age brackets. They will be better informed, and all of us involved in the health space must be there to offer them the value asked for. It is a series of things that we do in our association. First of all, through our products, what happens lately is that we see products that become broader so as to also offer services. And I will give you certain examples. For instance, in a difficult category such as quitting smoking, still 35% of Greek citizens smoke, either traditional smoke or through the new methods, if you like, electric and so forth. There are now products abroad that also are imported in Greece, which are substitutes of nicotine or food supplement, through which one can control through the mobile what is the consumption, get informed on how they are in the consumption cycle, and also to inform the pharmacist or a doctor. This is an example. A second example is through information, how our products are connected with technology in other ways. For instance, many of persons ailing of the gastrointestinal system. They are chronic patients. Now we have applications in our products that they have these patients and register their life style and what are the triggering factors of their symptoms, and on the basis of that also to inform the healthcare professional. Beyond the issue of products and services to the consumer, it's also the part concerning the support to health professionals. It has been mentioned by the two previous presidents. One of the basic things that we have established as EFEX with our last BOD is in establishing the Self-Care Academy. This will be an academy that will focus on health professionals, giving the priority to pharmacists, and we closely cooperate with the Panhellenic Pharmacists Association so as to have a standing program of professional training with regard to self-care. That is, get attract, if you like, capture the particular categories and inform everyone on the existing ailments. What is the pathology? What are the decision trees? What are the symptoms leading you to the doctor and so forth. So this is a major program, and that will be the biggest innovation that we might be able to sustain as an industry, because the reality is that what we do that currently individually. We do not want that. That will not have the gravitas needed. We want to institutionalize that and do it as an industry at large. And this will further help us in the other things, such as drugstores, in-store services, and so forth. And of course, we support establishing the services. And last but not least, regarding information campaigns, according to the latest pulse, it seems that Greeks are not fully aware of the self-care. So they must have more information on how to deal with the particular ailments. Thank you, Mr. Karelos. I didn't know the term self-care, and I see a lot of innovative things there. Madam Tsekoura, you have a very intensive presence in the field. How does all that sound to you? Let me start by thanking you for my presence here. I will not take up too much time. I would like to address the questions that you raised. I am the vice president of the Hellenic Patients Association, representing being the umbrella organization of 85 different patient associations. I see the role of the session, the title, but I didn't see the patients anywhere. Physicians and pharmacists are the immediate, of course, interlocutors of the health system, starting from timely diagnosis till the effective use of treatments and medicines. And their contribution, of course, determines access and compliance. But if we want a really patient-centered health system, this chain must also include the voice of the patients and the identification of their needs. So what happens currently? Health environment has radically changed. Let me make a brief mention to the pharmacists. We already have, along with the physicians associations and the Panhellenic Pharmacy Association, we've already signed an MOU so as to jointly do things, especially vis-à-vis prevention and appropriate information. It is not easy, however, now to have 87 actually, different categories of patients in various regions of Greece to be fully informed. They're so difficult to reach. There are so many socioeconomic imbalances and differences. We'll have discrepancies, and it's for the first time that we must all jointly deal with that. There are people who have no access either to health services or drugstores. So pharmacists have a more intense role to play, and this has to be further demonstrated because the patient is the last person will have the direct contact with the pharmacist. Our country still has very serious discrepancies in access to health services and out-of-pocket payments. Recently, it was mentioned that the patients cease their treatments because they do not have the financial capacity to afford the various treatments. We have many cases of chronic patients that have not a single but many ailments. So physicians and pharmacists have a decisive role and must limit this overloading with rational prescription and rational use of the drugs available. Finally, we have digital transformation. It came along. It is a kind of My Health, e-prescription, e-file. Patients are not familiar with all that. Our association view this as a substantial problem. So we created the digital alphabet, the health alphabet, where all patients have access to that. We are coordinated with all scientific societies, so for the patient to know in lay words what a medical term means. We also created a digital academy, and we currently create the Patients Academy. And thus, we will have well-informed patients. This is most important for our association, to have well-informed patients, because unless this is the case, we cannot progress. We said that the health environment has changed, has shifted to prevention, timely diagnosis, preventive tests, lab tests, and vaccination, digitization of health, telemedicine. All that demands education. People must understand what this is all about. The quality of health services offered must have tangible results and secure equitable access and offer decency, feeling of decency to all patients. We want a system where physicians, pharmacists are not mere service providers, but they will have a very close cooperation with patient groups and patients' association for co-shaping policies. This is only how we can secure quality, sustainability, and real trust. Thank you, Madam Tsekoura. The fact that we do not have on the title the name of the patients is just an omission, a mere omission. You are here, aren't you? You are present on the panel because we realize that your role is very important and you have gained the trust and esteem of all health professionals. We thank you for that. And now let us proceed with the original statement by Mr. Ragousis, who is the president and CEO of Pfizer Hellas, who, as I've been told, is from Paros.
Well, Paros is nothing innovative, the island of Paros, but let's see what's innovative we can find in other things. Now, the question of today's debate or discussion is very interesting if one were to compare it against what we would be discussing 4 years ago. Now, if 4 years ago we gave the same answers, that would be good not to do it, because we learn from our mistakes. If we're to come up with some new answers, let's do so. I've been here since yesterday, and many answers have been given by the previous speakers as well. What has changed? What is changing? How we can adapt to the change? How we deal with innovation? And how we can work together. Most answers have already been given. I will just try to sum them up and add something else. If one were to look today, what changes as compared to 4 years ago, it's the pace at which things change. Is it 4 years? Yes, that's what's important, that in 4 years we have seen a change in pace. Because things now change at an exponential rate, and it's not easy for any of us, be we citizens, patients, or companies, to follow, keep up with that pace. Now, I will not go into the social repercussions and who can keep up with these changes, because it's not what we do. Let's see what happens to us. It was mentioned at some point yesterday that as we speak, China ranks first in investments, research and development. Now, I don't know whether anyone can fathom where China was 10 years ago, okay? And I don't know whether someone could actually realize what such a country can create in the next 5 years. I mean, how many new products will come from there, which will be added to the products that are coming from the United States and other countries that are innovative and that have innovative gravitas. Now, our role as Greeks is to sit down and decide or rather discuss how we will receive innovation or be a part of it. Because we are consumers of innovation to some extent, thank God. We're not creators of innovation. There is an indicator that shows where countries rank in innovation, and we are somewhere between 42 to 45. Now, 42, which is the better number, I'm not saying that someone needs to be happy or content, but if someone were to dig deeper and see, one would realize what the fields are in which we are ahead, and these are our people's capacity. Why is that important, you may ask? Well, because for a company to come to Greece, the first thing they look is whether there is capacity and skills. What we're missing, and if you go to a university, and I'm the least expert to talk about universities, but the first thing one will see if one goes to a university and if a company talks to a university is that in Greece there is a competitive production of research, of publications, of papers. You will find people who can hold the salt against the best in the world. And if you say, how many patents did you come up with after all this, the answer is usually disappointing. And the first thing we need to do is this, to cover this gap. If one were to check the results of this survey or this study, one will see exactly what happens. The second very important thing is institutions and processes, procedures. I feel that here in the Health World Conference, an important thing is that year after year the dialogue becomes better and more substantial. Even the beautiful debate we had and the controversy, as it were, is nice. I mean, we can't all share the same opinions. What's important is how we solve our differences and how we move forward. And if at the end of the day, the solution we adopt is an innovative one, or whether we stay attached to the deathly grip of the past. Okay, the world will move ahead one way or another. Those who will choose to stay behind and those who will choose to move forward is one's personal choice. Moving on to drugs. In drugs, 4 years ago, the important thing was the distribution channels and production. Now, thank God, most countries and most areas of countries, continents even, have already responded to this. And this is important for the things and for the progress of the discussion we have, how fast they react. Is there ever a continent that will lock itself in and produce everything for its own needs? No, that is certain. The course of things will not revert. But for one to participate more or less is a decision that will be made. I mean, it's different to participate in 1% or to, say, box a final product, and it's quite different to be in the initial research and production. So we need to move forward in this and to connect more to what the needs are, not only of the market, because the previous speaker said this very eloquently. We are here because we have the patients and we need to make the patients feel better. And the first thing we need to say for being in health to those who are not parts of healthcare is that health offers one more years to live, better years, productive years, creative years, and with active citizens. This is what it stands to offer. Now, how much one is willing to pay for this? Well, all evidence shows are conducive to the fact that the patients pay and they dig deep in their pockets. How much the state will pay is a decision of the state and all of us who pay our money into the state. But again, this is a decision that's debatable. The last decision of the state is to create an innovation fund. Is it a good or a bad decision? Well, it's a good decision because it's forward-looking. When in the next 5 years, and we already have products coming in that cannot be paid by each individual citizen, and I'm talking about the actual innovative drugs. Aren't all products innovative? No, we're talking about the innovative ones. We're not talking about the non-innovative ones. If they need to pay for them, they will need to find a process. 2 panels ago, it was mentioned that the countries that import them sooner are the countries that have access to clinical trials first. If one is to import the drug 652 days later, why would I give you a clinical trial? What will you tell me what my product does 652 days later? We're moving at incredible paces and speeds. This should have been granted. This should have been a given within the first 180 days from the use of the products. So when we're raising obstacles, 5 out of 12 need to have approved it, 5 countries need to have approved the drug, it's okay. I mean, not having the money is one thing. Not using it correctly is limiting. It's very limiting. Now, to conclude, as far as I'm concerned, the most important thing for the Innovation Fund is the intention of the state. It's a positive intention, most positive. Several years ago, they created a separate budget for vaccines, and on that basis one starts and says, well, I need to have scheduling, design, program to vaccinate people, to protect the population, the elderly mostly, because, well, the children are vaccinated one way or another. We used to vaccinate them in the past, but today Greece will be a society of the elderly, for better or for worse. So let's use the elderly that we have. Let's keep them healthy. There's no need to weep and cry from dusk till dawn that we have an aging society. It's true. Let's keep them safe and healthy. Second, we need to have an innovation mentality. We need to see ourselves in the next 10 years, how we will participate in the future. How we did that in the past 10 years is not helpful for anyone. Thank you very much. I will keep what you said, that we'll need to see how we will welcome innovation and how we will be not simply consumers of innovation. And the key word you said is innovation mindset. Right. Sir, you're the last, but you have the advantage of receiving a lot of stimuli to enrich your position. Mr. Kalamakis, you have the floor.
Thank you. Now, what's intensity? Population aging, equitable access in relation to geographic dispersion to patients, burnout of health professionals. What is the promise? The promise lies in the two mega trends in the field of health, the power of accuracy, prognosis, diagnosis, and treatment, so as to give the most effective solution to the patients and for them to go back to what is most important. And the value of extension, the big data and AI that expands the capacities of health professionals and health providers, health service providers to do more, deliver more with less. What is the challenge? This entails a cost. How can we overcome this problem? And how can we make health professionals the stars, the protagonists in this transfer? The first answer is, as Mr. Exadaktylos said, training. Training leverages both the power of extension and the intention of all the stakeholders in investing in that. How can we overcome the original cost, which we view as cost, but innovation should be viewed as a value investment instead of expenditure? We must all sit around and discover how we maximize and optimize the results vis-a-vis the cost. And how will we do that? By measuring. We can attain that by measuring accurately and reimbursing on the basis of the results obtained. So the way to overcome those difficulties is placing the emphasis on trainment, which is also an investment, and placing also the emphasis on the test and trying new methods. I would say that the biggest innovation is to change the way we do things. Let us not think of how we will merely buying molecules, active substances, or boxes of new devices. Let us consider how we can buy best results for the patients and how health professionals can offer these best results to as many as possible, inviting also the professionals and companies to participate. And in order to attain that, we need some kind of predictability and acceptance from the side of payers, both public and private sector, that on the basis of data, they would be reimbursing. Thank you. Thank you. Do we have a couple of minutes so as to wrap things up? The original presentations, we've heard a lot of thoughts. We warmly thank the speakers for whatever they've said. I believe that this roundtable broadened the term of innovation and did not limit it only in innovative drugs or devices, but also in ways of thinking, on training, on how we assess results and so forth. I warmly thank you for your participation and enjoy your lunch.